modality is contrast baths, so that's what we will be doing, and I'm going to start us off with our paper. Okay. So contrast baths are a physical agent modality, or PAM, that involves alternating between hot and cold baths. Alternating between the hot and cold baths will cause vasodilation or vasoconstriction, depending on the temperature of the bath to the affected area. Vasodilation and vasoconstriction can increase local blood circulation. The contrast baths can also increase active range of motion, decrease edema, decrease pain, and decrease stiffness to an infected area. Contrast baths have been found more effective in decreasing edema than using just ice. Occupational therapy practitioners use contrast baths on the hands and wrist. The appropriate diagnoses for contrast baths are osteoarthritis, rheumatoid arthritis, carpal tunnel syndrome, healed fractures to the fingers or wrist, and any injury that has caused inflammation or swelling, stiffness, or pain. Contrast baths are also the treatment method of choice for complex regional pain syndrome, also known as reflex sympathetic dystrophy. When utilizing contrast baths for a patient, it is essential the practitioner begins the process correctly. If the patient has edema in the affected area, then you would begin with the cold bath and end with the cold bath. When the patient is experiencing pain or stiffness, you would begin with the hot bath and end with the hot bath. When the patient initially inserts the infected area into the cold bath, they will then feel a cooling sensation, but as for the hot bath, the patient will feel a warming sensation.
Okay, so while a patient has their hand and wrist in the bath, a sponge may be used to squeeze. When performing a cold bath for a patient experiencing edema, have the patient tightly squeeze the sponge. When performing a hot bath for a patient suffering from pain or stiffness, have the patient squeeze the sponge gently. It is important to not allow a patient who has been diagnosed with carpal tunnel syndrome to use the sponge at all. The goal of using a physical agent modality such as contrast baths is to improve the client's ability to perform occupational functions. The practitioner is then able to involve the client in functional activities that may have otherwise been far too difficult to perform. The use of PAMs without application of functional activity is not considered occupational therapy. Some contraindications are open wounds, sutures, pins, or staples in place, infections, poor skin conditions, and any question of skin integrity. Using contrast baths with these conditions may decrease healing times and increase skin, joint, and wound irritation.
Good morning, Miss Wynn. How are you? Good. I'm Stephanie. I'm going to be the CODA that's working with you today, okay? So I saw that you have a really sore right wrist.
Oh yes, it's there's some pain and stiffness in the wrist and my finger as well.
Okay. Alrighty. So we are going to do a functional activity later on together. I know that you really love to paint, and so I want to kind of get you back to that. But before we start, I want to try something called a contrast bath.
Okay.
I know that sounds a little weird, but before we start, I'm going to ask you some questions and make sure that it's safe for you to do this activity. Okay? So let me look at your wrist. I'm not seeing any open wounds. I don't see any infection, anything like that. I'm not even really seeing any swelling. Do you feel like it's swollen? Okay. All right. Has anyone ever put any pins or anything in any of your joints?
No.
Again, I didn't see any scars. You don't feel like there's any infection?
No.
Okay. And I didn't see any. It looks good. Okay. And has anyone ever told you that you have carpal tunnel syndrome?
Oh no.
No. Okay. Alrighty, so because you are stiff and painful, we're actually going to begin in our hot bath and we will end in our hot bath, okay? We're gonna go back and forth 5 times. And then there are some sponges in each of our baths. So this is our hot and this is our cold. Because you are stiff, I'm gonna ask you once you put your hand in to really squeeze and kind of just work out, or gently, very gently, don't squeeze stop, don't squeeze stop. Gently, very gently, because you are stiff and painful, you're gonna gently squeeze and make sure that we don't irritate that stiffness, okay? Okay? All right, so I'm gonna check the temperatures just real quick. I wanna make sure it's not too warm. Okay, we're good there. this one is gonna feel a litoo bit cooler, especially coming from the hot, but hopefully it'll really help with that pain.
So what are the temperature of these baths?
So the hot, we want at 98 to 105.
Okay.
And this one is going to be 58 to 69.
Okay.
So it's gonna feel different. Okay, if you'll go ahead and take your right wrist for me. We're gonna start in the hot.
Oh, go wash your hands.
Oh yes, go wash your hands. Sorry. Miss Wynn, if you'll also take off any jewelry that you have on that hand. Okay, all right. Go ahead and put your hand in then, and you're going to very gently squeeze. We're gonna leave it in there for 4 minutes. Okay, so we're at 4 minutes. You've done a great job. How are you feeling?
It's a little warm.
It is warm. Okay, this one's gonna feel cooler if you'll go in and gently squeeze. And then be at 4 minutes. Okay, you've done a great 4 minutes. It's really, I know, it's gonna feel different. So how's your hand feeling?
That's nice.
It's nice. The warm's better on it.
Uh-huh.
Okay. Alright, you'll go ahead and go back after 4 minutes. Okay, and you're 4 minutes, and so we're gonna come back. So fortunately you get to end in a nice one. Real gentle, you're doing a great job. Okay, and it's been your 4 minutes, so if I can look at your hand. Okay, all right, so how's the pain feeling?
Oh, it's way better.
Better, good, good, okay. So let's go ahead and do your functional activity. Like I said earlier, I know you love to paint, so we're gonna move to the gym. So if you'll just flip around for me in the gym, we have some watercolors that you can use. So again, because you have the pain and stiffness, we don't really want to do anything that's going to aggravate that stiffness, and so we're going to do an activity that's just really nice and light and easy on your.
Just use some water to dip.
Just water to dip in, and then you're going to paint on the paper. Nice and smooth, easy strokes.
I
And
can
this
move
is-
my wrist more now.
Do you feel like it's better?
Yes.
Great. I'm glad that contrast bath helped.
Thank you.